Welcome back to ABC 7 at 4. I'm Mark Ross. October is, of course, Breast Cancer Awareness Month. Our medical contributor, Dr. Ogechika Alozie with Sunset West Health, is here to remind us why it's important for women to get screened this month. Doctor, how many women in the U.S. develop breast cancer?
It depends on the numbers that you're looking at, actually. And, we'll show the graphic, but what I want to focus on specifically, though, is that we talk a lot about different cancers and Susan G. Komen and everything else. But about 1 in 8 in the United States actually develop breast cancer in their lifetime, and it's the second leading cause of death and second leading cause of cancer death. What the funny thing about it, and I actually saw this on one of your affiliates today, is that men also get breast cancer. And the unfortunate thing is that of the 2,800 that get it, around 500 will actually die.
And what's also interesting is that Black and Hispanic women are more likely to die from breast cancer.
Yeah, so it's minorities, right? It's a lot of things that you and I talk about all the time. It's a lot of the socioeconomic status, it's access, it's fear, it's knowledge, and the things we talked about in health literacy, whether it's breast cancer in Hispanic women or African American women, and we'll dive into some of those numbers in a little bit as well.
And it can't be said enough, early detection is critical. Why don't more women get screened?
The biggest thing you would think is fear, but it's not actually. It's finances. And so a lot of women just don't believe they can afford it, or they've been given a bill for it. We'll give some resources later. But the other thing, and you can see that in the left-hand side, is about 1 in 5 are actually just straight up afraid. They're afraid of a diagnosis of breast cancer. And because of that, what you find out is that about 1/3 of women above the age of 40 may have had a screening, but they're not up to date. 1 in 10 have never had a screening, and that's really what we need to focus on, and we'll talk about what ages you need to get screened shortly.
Which is our next graphic here, the guidelines for screening for women with average risk of breast cancer.
Right, so they're broken down into 3 groups. If you're 40 to 44, you should at least have the option of starting a mammogram screening, right? It's not necessarily driven by the guidelines just yet, but in that key age of 45 to 54, you should go one every year. So that's about 10 years. Once you get to 55, it can be expanded. It's a conversation that you should again have with your provider about whether you need it and what your risk factors are.
What are some of the other statistics when it comes to mammograms?
The interesting thing about mammograms, if you take a sort of bucket, and there's a busy slide and I'll walk you through it, if 1,000 women get breast screening or get a mammogram, I think the number you should really think about is that 5 of that 1,000 are actually going to get breast cancer. 100 will be asked to come back, and you work it down, about 19 will actually have to have a minimally invasive biopsy. One of the things that we didn't talk about, and it says it very clearly here, is that the cure rate is so high that if you are screened appropriately and get diagnosed early, 98 to 99% have a survival rate.
And there are some excellent resources here locally for women who are fighting breast cancer or need screenings. Of course, Desert Imaging has their Memos on the Move. We're all familiar here at ABC-7 with the Stand with Estella campaign over the years.
Absolutely.
And the Rio Grande Cancer Foundation, also an excellent resource. And at one time or another, I know the Stand with Estella campaign will offer free mammograms.
It's not just them. There's a number of organizations that aren't on the screen because of space that actually offer free mammograms. You just need to find out. Most of the FQHCs, most of the primary care organizations around the city know how to access these. Don't be afraid of a diagnosis. Don't be afraid of the cost. You should get screened.
And in honor of Breast Cancer Awareness Month, Dr. Alozie has his pink Nikes on. He's ready to go.
They're dirty too, wow.
ABC-7 medical contributor Dr. Ogechika Alozie, thank you, sir.
Thank you, sir.